So if I ask my colleague Becky to introduce herself first.
Hi, so morning everyone, thanks for coming. So my name's Dr. Rebecca Cannon, she, her, hers, and I'm a specialty registrar in community sexual and reproductive health. So what that means is that I'm a doctor and I work both at Umbrella and also within public health at Birmingham City Council.
Thanks, Becky. And then I'm Doreen Rowler. I also work at Birmingham City Council and I work in the Public Health Division as a senior officer, and my role remit is fast track cities and sexual health. My pronouns are she, her or hers. And if I could just ask everyone to keep their microphones off if you're not speaking, just so we can ensure that the person speaking can be heard properly without any background noise. And just to let you all know, the session is being recorded. So yeah, you should see that at the top of your screen that it's being recorded so anyone can catch up on it in future if they can't attend in person. And you may have seen this slide if you've attended any of the previous webinars in the series, but we'll be using the Safe Places approach for all events throughout LGBT History Month, just to make sure that everyone attending the sessions can learn and share and grow. So the approach that we'll be expecting of both attendees and hosts is that we all respect one another, we all use empathy to acknowledge the feelings, experiences and identities of those around us. We all use a caring approach, just creating a non-judgmental and caring space for everyone to be as authentic as they can be. Creating a supportive space so that we can listen and empower one another. And we want to be as inclusive as possible, so include all LGBTQ plus identities and experiences, making sure that we create inclusive spaces for those who are seldom heard within the community and allow them to be seen and heard. So this webinar forms part of a series of events as part of LGBT History Month, as many of you are probably already aware of, as you might have signed up to a few sessions, and throughout the month and during this webinar, of course, we'll be aiming to tackle LGBTQAI plus health inequalities, inform and drive the actions of the proud Rainbow City Partnership. So that's the partnership network of organisations who work together to tackle LGBT inequalities and champion people within the space, and just kind of make sure voices are heard as much as possible. Another aim is to build Birmingham as a centre of LGBTQ plus health and wellbeing and innovation. So we all know that there's lots going on across the city, lots of groundbreaking and exciting work in this space, and it's just making sure that it's celebrated. It's people are aware of it, and people know that they can come to Birmingham and it's a safe place for them to be their authentic selves. And then the last aim is to support the National LGBT Month theme of Under the Scope, which is focusing on the medical and healthcare side of LGBT inequalities. So in this webinar in particular, we're going to cover the following. We're going to talk about what does good sexual health look like. We're going to try and focus on, we're going to try and be as positive as we can about sexual health, and obviously there are elements of sexual health that there are issues that are faced within LGBTQ plus groups, and we will be talking about those, but there's lots of interventions that are around that can empower this community to live as a normal a life as possible with and any of the conditions that we talk about. So yeah, we'll just be talking about some of the issues faced, and also where you, excuse me, sorry, where you can get support for your sexual health. So we'll be signposting to some local organisations that offer support in Birmingham. And just for the purpose of this webinar, when we say LGBT, we do mean all LGBTQIA plus groups. So I'm going to hand over.
Thanks, Julie. Sorry to jump the gun.
No, that's all right.
Thank you. So we can't talk about sexual health without asking ourselves, what is sexual health? And very helpfully, the World Health Organization has a definition for us. So they clarify that sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality, and not just the absence of disease, dysfunction, or infirmity. So what we're looking at is something that is actually positive, not just the absence of the negatives. And sexual health requires a positive and respectful approach to sexuality and sexual relationships. And for those who choose to engage in sexual activity, they should be able to have the possibility to have pleasurable and safe sexual experiences free of coercion, discrimination, and violence. And the World Health Organization goes on to say that for sexual health to be attained and maintained, the sexual health rights of all persons must be respected, protected, and fulfilled. So OHID, which is the Office for Health Improvement and Disparities in the UK, clarifies that sexual health promotion should include advice, information, education and services around the topics of contraception, STIs, HIV and also termination of pregnancy, so abortion care services. But really, I think we need to be going further than that. So we need to be thinking, how do we make sure that people can have safe, pleasurable, fulfilling sexual experiences? And that's through other methods of support, so psychosexual support, and making sure that people are free from things like coercion and abuse. So everyone has sexual health, but not everyone has good sexual health. So if we don't actively achieve and maintain good sexual health, then obviously there can be negative consequences. And these can include unplanned or unwanted pregnancies and abortions, psychological consequences, poor opportunities. So for people who are unable to focus and live out, other aspects of their lives because of negative experiences or poor sexual health. And then obviously the common things that people think about, so transmission and acquisition of infections, and also the implications of that, so potential for some cancers, liver problems, fertility issues, and also poor outcomes for parents and babies. And really by this slide, what we're saying is not that this is the sole responsibility of the person, the individual, the service user, but actually this is a joint responsibility between service providers and organisations and the individuals to maintain good sexual health in their population. So why is this particularly relevant to the LGBT plus community? So we're definitely not saying by this talk that sexual health is an LGBT specific issue, but we have to acknowledge that being part of the LGBT community can mean that you've had different experiences and that you may have extra challenges, particularly when accessing healthcare services. So this data is from a report from YouGov research done in 2018 about the experiences of LGBT people when accessing healthcare services. So it states that 1 in 8 LGBT people had experienced some form of unequal treatment because they're LGBT by healthcare staff. Nearly 1 in 4 LGBT people had witnessed discriminatory or negative remarks against LGBT people by healthcare staff. 1 in 7 had avoided treatment for fear of discrimination because they're LGBT. 7 in 10 trans people reported being impacted by transphobia when accessing general health services. 7 in 10. And also that trans people of colour experience transphobia from trans-specific healthcare providers at more than double the rate of white respondents. And, I don't think the sentiment of this slide will be brand new information, unfortunately, to anyone. I think it's really stark and really shocking to see those figures in black and white. And we need to appreciate that these are extra challenges for people accessing care. And obviously, if you've had bad experiences in the past or you anticipate having bad experiences in the future, then you're going to be less likely to access care. So to look at this from the other perspective, if we look at the data, so this is GumCAD data, so annual data recorded by the government about STI prevalence, and we're going to look specifically at West Midlands because that's where we're based. So looking at data from 2022, we can see that actually amongst some areas of the LGBT community, STI rates are significantly higher. So chlamydia rates amongst gay, bisexual or other men who have sex with men, for which I'm going to say GBMSM because that's quite a mouthful, were 14 times higher than amongst men who have sex with women, although lower for women who have sex with women compared to women who have sex with men. Gonorrhea rates amongst GBMSM were 28 times higher than men who have sex with men, and nearly twice as high amongst women who have sex with women than women who have sex with men. And syphilis was 75 times higher in GBMSM compared to men who have sex with women, and nearly 3 times higher in women who have sex with women compared to women who have sex with men. And you could look at this and think maybe these people are the people that are more likely to attend, and that's why we're getting higher diagnosis rates. But actually, if we're looking at the figures and that's 75 times 28 times higher, I don't think we can deny that there's an observable difference. And really what this is highlighting is that the people who need the services the most are perhaps the people that have the most barriers to accessing the services. So as Doreen said when we started, although we have to highlight the challenges, we don't want to focus on the negatives. And when we move away from sort of the more traditional STIs that people think about, we can look to the Mpox outbreak a couple of years ago as a positive thing that happened within sexual health. So Mpox is a virus that causes very painful ulcers, often around the genitals, and also flu-like symptoms. In some people it can be very mild, in some people it can be really severe, really debilitating pain, really nasty flu-like symptoms. It's a very easily transmissible virus from close contact between people, especially through sex, and it's mainly been found within the GBMSM community. However, after the outbreak in 2022, there was a huge push for public awareness and for behaviour change, so self-isolation amongst people with symptoms, reducing the risk of acquiring Mpox, and there also was a rollout of a vaccine programme. So we used the smallpox vaccine to try and reduce the risk of people requiring Mpox. And a report by UKHSA showed that all these changes in a collaborative approach between the service provider and the service user in the community helped to reduce the risk of Mpox resurgence in the UK. And this is shown by the figures. So after the initial outbreak, there were 3,000 new cases of Mpox in the UK in 2022. And this fell to just 143 new cases in 2023. So I think this is a fantastic example of how, when we work together, we can help to sort of reduce new infections, and that all these health promotion things that we talk about do work and can work. So I'll pass back to Doreen now.
Thanks, Becky. So if we move on to HIV and hepatitis, some of you may know both HIV and hepatitis are they're bloodborne viruses because they're present in the blood. So HIV is a virus that damages the immune system and can weaken your ability to fight disease, but it's very preventable, especially with access to new medications. Medication treatment has hugely advanced within the past sort of 30 years, and it's accessible to everyone locally and nationally. So yeah, HIV is very, very treatable. And then hepatitis B and C are also viruses, but they tend to target the liver. There are vaccinations to protect against hepatitis B and medications that, again, help the body fight both viruses after acquisition. So again, lots of treatment available for both conditions, again, both locally and nationally. So both HIV and hepatitis are spread by condomless sex, sharing needles or injecting equipment, or from mother to child during pregnancy, childbirth, or breastfeeding. So we're just going to go through some of the data just very briefly to give you some context. So in Birmingham in 2022, there were around 2,200 people living with HIV, but this is an approximation based on national figures, only because it's very difficult to know exactly how many people are living with HIV. So this figure is based on modelling. And then there were around 222 new diagnoses of hepatitis B and 139 new diagnoses of hepatitis C in Birmingham, again in 2022. And then across the UK during 2022, men exposed through sex between men accounted for around 30% of new HIV diagnoses, women exposed by sex with men for around 23% of new HIV diagnoses, and then men exposed through sex with women for around 16.8% of new HIV diagnoses. And then for hepatitis C, men who have sex with men are also an at-risk group for transmission. And then men who have sex with men living with HIV, especially for those reporting high-risk sexual practices, are disproportionately affected by hepatitis C compared to HIV negative men who have sex with men. So we can obviously see from the data that gay and bisexual men who have sex with men are at greater risk of contracting HIV and hepatitis. But there are plenty of behavioural and medicinal opportunities to prevent the transmission of all three viruses. So things such as simply condom use, vaccination against hepatitis B, which I've mentioned previously, and then there's prevention medication that we're going to talk a bit more about later in the webinar, such as pre-exposure prophylaxis, which you can take before if you think you're going to be exposed to HIV, and you can take that and it can prevent you from acquiring the virus, or post-exposure prophylaxis, which you can take 72 hours after being exposed to the virus. So plenty of things that we can do to prevent the transmission of the virus, and just maintain good sexual health. And then there's, of course, testing for HIV, hepatitis B and hepatitis C, and all three can be diagnosed by a simple blood test. So, of course, the earlier that you can get tested, the earlier you can get diagnosed, and therefore the quicker you can start a course of treatment. As I mentioned, treatment for all three conditions are very accessible, and they do lead to much better health outcomes. So people on treatment can reduce viral loads and live relatively normal, healthy lives with the virus. And treatment also allows for reduced transmission. So if you're on treatment, you're less likely to pass on the virus because of the reduced viral load in your blood. And of course, identifying anyone who is high risk but tests negative for the conditions enables us to vaccinate against hepatitis B and provide pre-exposure prophylaxis, or PrEP, and just raise awareness of the risks that are involved, and the behaviour change methods that we can use to reduce the risk of acquiring HIV and hepatitis. So some of you may know this week is actually National HIV Testing Week, and there's a range of activity taking place across Birmingham. So we've got a few different things happening. If I go through the activities, so my colleague Esme is just going to share some links in the chat. So we've got a few testing hubs across the city that are being run by CGL, the Drugs and Alcohol Service provider. And I know there's one on today at the moment, actually, in Kings Heath. There's a hub in Erdington tomorrow, and then at Lonsdale House tomorrow as well. So plenty of opportunity to go and get a test in person. Anyone living in Birmingham can also get a free test through any umbrella sexual health clinic. So there's several clinics dotted around Birmingham, and what you can do is go along, ask them to get tested for HIV, and it's easy as usually you can get an appointment on the same day, and if not, then you'll be advised when the next available time is for an appointment. And then you can also get a free test online, so you can get it's a self-sampling test that you can order, again, through the Umbrella Sexual Health Service or through the National HIV Testing Service, and the test comes with complete instructions, so you don't need to kind of figure out what you're trying to do with it. And if you send your samples off, you can usually get your results by text message within a few days. So testing is super easy, and as I mentioned, the sooner you get tested, the sooner you can get diagnosed and get onto treatment. And then just to raise that locally, in order to tackle HIV, hepatitis C, and also TB in Birmingham, we've signed up to an international initiative called Fast Track Cities Plus. And what this means is that we are committed as a city to achieve a set of goals for all 4 conditions by 2030. There's a 2035 for TB, so a slightly later deadline because of TB being a bit more complex. But we are signed up, which means we're committed, and you can find out a bit more about what this means in Birmingham and have a look at some of the targets on our website. I think Esme's just kindly shared a link on the chat for you to have a look at. And it's not just the Birmingham City Council Public Health Division that signed up. We've got commitment from local hospital trusts. We've got commitment from Umbrella, CGL, UK HSA, the Integrated Care Board, and lots of other local organisations. So it's a very cross-sectoral approach. We're all trying to work together to commit to these targets to tackle HIV, Hep B, Hep C, and TB in Birmingham. So I'm going to pass you over to Becky again to go through the last few slides.
Okay, so we know that everyone has sexual health, and we know that if we don't do things to maintain and promote good sexual health, then people can have poor sexual health. So what can we do? So the first thing is to raise awareness. So we need to raise awareness amongst service users about what services we have available, and also amongst the services about additional challenges or additional LGBT specific needs that they need to be addressing. We need to be not only reactive, so responding to things that happen, but also proactive to ensure that everyone can maintain good sexual health. We need to keep services inclusive, aware, and up to date. And really luckily in Birmingham, we've got Birmingham LGBT, which I'll talk a bit more about later. So we've got specific, aware, inclusive services. So obviously we know, as Doreen's already talked about a little bit, prevention is always better than a cure, and there are loads of things we can do to prevent consequences of bad sexual health. So specifically for some areas of the LGBT community, so such as for GBMSM, there are specific vaccines offered at sexual health clinics. So the HPV vaccine, so that's the virus that causes genital warts and some forms of mouth, genital, rectal cancer. We've got vaccines against hepatitis A and hepatitis B. We've got PrEP, which is medication people can take to stop them from acquiring HIV. And obviously regular testing means that we can pick up new diagnoses early, we can treat people, and then we can prevent onward infection to other people. And obviously I'm a doctor, I'm always going to talk about condoms. Condoms are great for good sexual health, and we should be promoting and supporting people to use them where able and if they want to. However, obviously, if people do have diagnoses, we need to have good, accessible, approachable treatment services. So this is a picture here of Hawthorne House, which is one of our HIV care services in Birmingham at the Heartlands Hospital. We've got a really good team there, and they're able to look after, support patients, people who are living with HIV. We've also got hepatology services, so for people diagnosed with hepatitis, and obviously treatment for other STIs can be sought at BLGBT, Umbrella, or even at some pharmacies. And obviously, as we mentioned before, if we're considering sexual health as a whole, it's not just about infections, treating diseases, it's also about what other support services. And luckily, we've got really good services, really good links between different service providers in Birmingham for things like counselling, CGL, so substance misuse services, IDVAs and ISVAs, so independent advocates for people who've experienced domestic or sexual violences, psychosexual services, and loads of other things. So as Doreen mentioned earlier, PrEP is a really good way to maintain good sexual health. So PrEP is tablets that people can take either every day or around an anticipated event where they may be at risk of acquiring HIV, and they're really, really effective. So research has shown 86% effective at reducing the risk of HIV, and they're for people who are having sex with people who potentially HIV status is unknown, or people living with HIV but HIV is not controlled, because as we've mentioned before, anyone who's living with HIV and is on medication and the level of the virus in the blood is so low that we can't detect it with the blood tests that we have, we know that these people are unable to pass on HIV to anyone else. So that's what we mean when we say U equals U, so undetectable means untransmissible. And PrEP is available to some specific people within the LGBT community from local sexual health clinics. So the last thing really that I'm going to talk about is contraception. Contraception is definitely a passion of mine and I could talk about it for ages, but I think it's really important and specifically important amongst the LGBT community, especially amongst trans or non-binary individuals. There's a lot of misinformation out there, and that's not just within the community, it's also amongst healthcare services, healthcare providers. So this is all taken from national guidance from the Faculty of Sexual and Reproductive Health, who are the main body within the UK delivering sexual and reproductive healthcare guidelines. And what they say is contraception is recommended for trans men or non-binary people who are assigned female at birth if they haven't had surgery that would prevent them from getting pregnant, if they're having frontal or vaginal sex that has a risk of pregnancy, and they do not wish to conceive. So what do we mean by that? So people who are capable of getting pregnant, who are having the kind of sex that could get them pregnant and who don't want to get pregnant, should be able to access contraception should they want to. Obviously, if they want to get pregnant, then contraception is counterintuitive. The important thing about this is someone who a trans man or non-binary person who's using T, so testosterone or hormone blocking treatment, should be aware that actually this is not a contraceptive. And I'm an abortion provider myself. I've seen this so many times in so many patients who have been given misinformation from other healthcare professionals from other areas and aren't aware of this. And it's really important, especially because if someone does get pregnant whilst taking this treatment, there's an increased risk to a developing fetus. So someone who's pregnant should not be on this treatment, and someone who's on this treatment should be aware of that there is a risk if they do become pregnant. The other thing to be aware of, obviously, is condoms are a good form of contraception with the additional benefit of protection against STIs, so they kind of work in both ways. So what are our options when talking about contraception for trans people? And the most important thing is that first sentence in bold. I know this is a very wordy slide, I'm sorry, but it's really important. So there's no restriction on the use of any method of contraception on account of someone's gender identity. So what we mean by that is trans people should be able to choose a method of contraception based on all the methods that we have, and they're not excluded from any method just because of the fact that they're trans or non-binary. So what does that mean? So that means that we've got all the methods available, and as with anyone else that we're talking to, we need to be able to give people the options and the information to make their own decisions. So I'm very briefly going to talk through some of the methods. So say the copper coil, a really effective method. So it's a little T-shaped device that sits in the womb for many years, really popular, especially amongst cisgender women at the moment. Lots of people don't want hormonal methods. Could be appropriate for trans or non-binary people. However, it does involve an intimate genital examination to fit, and we know that copper coils may make menstrual bleeding heavier, longer, or more painful, which may be really dysphoric for someone. It may not be for someone else, so it's just about giving the information and letting people make their own decisions. The progestogen only method. So progestogen is a hormone that when used in contraception stops the body from releasing an egg, amongst other things, stopping people from getting pregnant. Even though it's a hormone, it's safe, it's fine to take with other hormone treatment like testosterone, and it doesn't interfere with that. The other thing is that we know progestogen only methods can stop or significantly reduce periods, menstrual bleeding, which can make them a really popular method amongst some trans or non-binary people. So those are really good options and really important things to talk about. The other contraception methods that we talk about are combined methods, so like the classic pill that people start when they're 16 from their GP, the patch, the ring. So these are methods that contain estrogen and progestogen. And again, they're absolutely fine for someone who's trans or non-binary to take, but just to be aware that taking something with estrogen can counteract the masculinizing effects of testosterone, so may not be appropriate for some people. But really important points are taking testosterone is not a contraception, but taking it with contraception doesn't reduce the effectiveness of that method. Someone taking treatment can be eligible for all forms of emergency contraception. So by that I mean like the morning after pill or the copper coil as a method after sex. So people should be able to have all the information and be empowered to make their own choices, irregardless of their gender identity. And just that final point there, so obviously on the other side of the spectrum, trans women and non-binary but assigned male at birth people who've not had bottom surgery should also be thinking about contraception if they're having sex with someone who's able to get pregnant and doesn't want to be. Okay, so we just put a quick slide here about a really great service that we're really lucky to have in Birmingham. So Birmingham LGBT is a local organisation with specifically trained staff, specifically tailored to the LGBT population. They're based in the city centre of Birmingham. They offer a wide range of services such as condoms, testing, counselling, mentoring, education, other support, as well as some sexual health clinics from umbrella staff that come across, and also support with sexual and domestic abuse. And Esme has very kindly put a link in the chat for me. So it's a really good service that we're lucky to have, and somewhere that people can go should they want to maintain sexual health, and also that we can be advertising and increasing awareness of amongst those communities. So to summarise, so we've talked about a lot today. The points that we really wanted to get across is, although sexual health is not specific to the LGBTQ plus community, it's especially relevant, and we need to be aware that people from the community may be, you know, coming with different experiences to others and with extra barriers and challenges. We need to destigmatize sexual health, and we need to empower people to have the right information to make informed decisions about sexual health. We need to raise awareness of the services that we have for those people, and also raise awareness amongst people who are providing services about specific needs, specific challenges that can be faced from people from different communities. So as I said, we've talked about a lot today. There's lots of services out there. The main things is we've got Birmingham LGBT and we've got Umbrella, which are really good services, and they'll be able to connect and sort of refer people on to different areas should they need other services as well in Birmingham. So this is just our slide. So as we mentioned earlier, this webinar is part of a series of webinars happening across February for LGBTQ plus History Month, and the QR code in the top right can take you to sign up, register for other webinars. Specifically, there's a webinar happening on the 28th of February at 11 AM by our health protection team, which is on similar topics around sexual health, vaccinations, screening. So that'll be a really good one to attend. We'd also be really grateful if you could quickly scan the QR code on the bottom left, just to give us some feedback about today's webinar as well. So thank you all so much for listening. I think if we stop the recording now, and I don't know if anyone has any comments or questions.